Hi, my name is Steve Hodgson. I'm Director of Hallamshire Physiotherapy. I'm going to talk today about core stability and some of the problems that we've seen in the last few years at the clinic. It's not uncommon over the last few years for people to present with back problems, and then when you ask them about what they've been doing core stability exercises where they're spending a lot of time lying on the back, sucking their abdominal muscles in and trying to activate the muscles on the belief that they have a weak core. It is very fashionable at the moment, which worries me that anything that's fashionable is usually not driven by any scientific basis. However, there is this belief that we are becoming unstable in our spines. And then by making muscles work, especially abdominal muscles, we lose that instability, we start to become more solid, we start to get a stronger core, and our back pain goes. It doesn't work, and certainly from the patients we see on a regular basis, it can possibly make people worse because they become rigid. People stop breathing, they hold a breath, they start to activate muscles individually, which is a bizarre concept, and we'll come back to that in a minute. And they think that the stronger I get through the middle, the stronger my abdominals become, the better I will. Well, for several reasons, this from my experience and from what I've read is wrong. The first being that if you tell somebody they've got an unstable spine and if they got stronger and started to work the core, they would improve. It frightens people. The belief in stability, if you think your spine's unstable, it worries people, and because of that they will behave as though they've got to look after the spine, and that has a huge psychological effect. So we know that the psychological effects of back pain can make a huge difference into how people behave and their eventual outcomes. So giving terms like instability and weakness and all the other things that are given sometimes can actually make people worse. So you've got to be careful what sort of language you use. So it's not a good idea to set into people's head. The next thing is, if you have got a weak core, if it did exist, by sucking abdominal muscles in, you're not necessarily going to develop a stronger core. What you're going to develop is a stiff core. A stiff core basically means that you will lose any rotation through your spine. You'll often find that you can't move because you become tighter, and this belief that you've got to look after it. All these things engender fear into patients, which makes people worse. Your spine should have an element of mobility, and it should be able to move for the tasks which you require it to do. Once you start to think that you've got a weak core and actually start to have to strengthen your core individually, you make people stiffer, and you will get people through the clinic who for many years are getting tighter and tighter, and the back pain isn't working. The problem is, as you become tighter and stiffer in your back, as you activate muscles, you compress your back. If you keep activating more and more muscles, you find you keep activating them all the time, which adds to the loading patterns through your back, which can actually make people worse. So telling people that they need to strengthen the core without moving is positively harmful to your back from my clinical experience. The other problem is people learn to activate muscles by squeezing their muscles in, squeezing their abdominals in, for instance, and holding it and then trying to function. Well, we do not function by thinking about muscles. We function by tasks. We think about activities, we rehearse activities, we learn the activities, and our brain sorts the muscles out. We don't think about muscles when we're trying to perform things. For lots of reasons, it is not possible. We've got hundreds of muscles. Our brains cannot cognitively think about how do we activate all these muscles when we require things. If we're reaching our arm up, if we're trying to play golf, if we're trying to hit something, we're trying to move, we're trying to run, you have to practice the technique, and we perfect the technique. And as we perfect the technique, our muscles are selected by the body which provide the most optimal movement, hopefully. That is how you change things. So by activating them, by sucking things initially, you become rigid. You cannot work like that. We've got to maintain our functionality. So long term, as a recap, we work through movement. We need rotation. We need to activate. We need control of our trunk, not just strength. If we aim just to get strength back with our trunk, we will get into problems potentially where we become rigid and believe that we need to get stronger and stronger. And this can make people worse. There is no evidence that I've read that suggests that core stability type exercises give any long-term benefit for people with low back pain. Learn to use your spine correctly, get better control of your trunk, and learn to love your spine. It's probably the best thing you can do. It will respond if you use it in a correct way. Thank you very much. If you require any further information, please go to our website at hallamshirephysiotherapy.com, where you'll find other videos and you'll be able to look at further information about particular types of injury. Thank you very much.